Okay, ladies and gentlemen, welcome to today's webinar. I'm Dr. Raja Ahmad Shaharul, a family medicine specialist and also a medical advisor to Naluri, which is hosting this webinar today. So today we're going to talk a bit about COVID-19. So a bit of basics, maybe most of the things you've heard before, but I will elaborate a bit more on them, and we get a question and answer Q&A sessions right at the end. Okay, before we continue, okay, that's me at the bottom. So just to make sure that I'm the right person, so we'll start off with the first slides right now. Okay, so basically this is the learning outcome today. So hopefully we'll go through the introductions to COVID-19, yeah, and then what the current situation is in the country and also worldwide, what the method of transmission is. Surprisingly, still a lot of people are very confused with regards to it, symptoms and when need to test, why the need for the MCO currently, some general advice and also summary. Okay, so basically let's talk a bit more about COVID. What is actually COVID? Okay, COVID is actually short form. COVID is actually a short form for, let's get my face out of that screen first. Okay, COVID is actually a short form for, where is the screen gone? Sorry. Okay, COVID is actually a short form for coronavirus disease. Okay, so the COVID stands for coronavirus disease, and the 19 is just the year of which it started, which is late last year. So actually, this coronavirus is actually a family of viruses. Okay, so maybe you are more familiar with regards to SARS and MERS. So SARS and MERS are also caused by this family of coronaviruses, okay, and so is COVID-19. Interestingly enough, they call the COVID-19 virus that caused COVID-19, they call it SARS-CoV-2, okay, and interestingly, this SARS-CoV-2 shares 80% of the same RNA or the genome material as the virus that causes SARS, yeah, SARS-CoV. So that's why doctors, researchers, biochemists, they all look at the previous SARS outbreak to try and predict the behavior of this virus, because it very closely in genome, very closely related in genome with the virus that causes SARS previously. Okay, now most of these coronavirus, they actually originated from bats, yeah, interestingly. So from bats, they are being consumed by human beings and also sometimes passed on to another animal. So for example, during the MERS outbreak, yeah, Middle Eastern Respiratory Syndrome, these bats are passed on to camels. Okay, the virus from the bats passed on to camels, and these viruses from the camels passed on to the human being. So that's why at that time MERS happens a lot in the Middle East, because there's a lot of camels there. So SARS previously, again, from bats, they passed on to civet cats, which are wild cats, and then they are passed on to the human host. Now with COVID-19, there's very great evidence that it originates from bats, but we don't know what the intermediate host is. Okay, so as you all know, this COVID started in Wuhan. It was traced to a seafood market in Huanan seafood market. But the seafood market doesn't necessarily just sell seafood. They sell a lot of other things, a lot of other live animals. So we don't really know what the secondary host is. And this basically passed on to the humans, and then it went on from human to human transmission. Okay? Now, to put it into perspective, COVID-19 is very, very contagious. Yeah, it spreads very quickly compared to, say, previously SARS. Okay, SARS, over the whole episode when SARS was spreading, only 8,000 plus people worldwide had SARS. Okay, and out of that 8,000, only about 800 plus died. So about 10% mortality rate. Okay, but currently SARS spreads on very, very quickly. I will show you the data afterwards. And at the same time, the mortality rate is not as high as either SARS or MERS. Yeah, now they're talking about 3%. So about every 100 cases, about 3 people die from SARS. Okay, compared to SARS, 10%. MERS is even higher, yeah, up to 30%. And you're not talking about Ebola. Ebola is even worse. Yeah, once you get Ebola, usually you die. So the mortality is not so high, but it spreads very quickly. Okay, and the mortality rate, so I just bring this away. So the mortality rate is actually higher in older people. Okay, those who are older, orang tua, and also people who have diseases, yeah, chronic diseases such as heart diseases, lung diseases, kidney problems, diabetes. Okay, so those people who already have diseases, when they get COVID-19, these are the people who actually have a higher mortality rate. Okay, so let's go on again. Okay, what is the current worldwide status of COVID-19? Okay, so if I can bring this up. Okay, if you look, this is the worldwide situation currently. Okay, this is a good a good site for you to see actually. Just bring it up for you. So all those dots you see are where COVID has gone. Okay, so it's basically worldwide. There are more than 150 countries now with COVID-19. As you can see, China, the one with the biggest dots, is China. Okay, and then of course down the middle there would be Italy and then Spain. Okay, now if I could get more information about this, hold on 1 minute. Okay, so if you look at the list, so China has the most confirmed cases with 3,000 reported deaths, but Italy is quickly catching up. Yeah, their mortality rate or Italy's death actually is quite high. So Europe currently is the hotbed for COVID-19. But if you go down the list, if you look, Malaysia is not that far down. Okay, so Southeast Asia, we are the country with the biggest number of cases. And in Asia, I think we're just behind South Korea and also China. So it's a big problem actually in Malaysia. Okay, so we'll go back to that at the minute. So as you can see, it's a very big problem here in Malaysia at the minute. So we have to really do something with regards to it. So actually, what are we doing? We first need to look at the method of transmission. Okay, let me get this away first. Okay, there's only one thing you need to know about how COVID-19 spreads. It only spreads through droplets. Okay, there is no scientific evidence that it spreads through anything else. So a lot of my patients ask me, doctor, does it spread through sweat? Does it spread through swimming, through diving, through blood? There's even people ask me, does it spread through sex? No. Okay, it spreads via droplets. And what we mean by droplets is that if you can imagine this person as somebody who is sick, when he coughs or he sneezes, he will emit droplets. Okay, that droplet can sometimes go up to a distance of 2 meters. So that's why we have this social distancing. Yeah, so at least 1.5 to 2 meters. People say 1 meter, but I would rather it be 1.5 to 2 meters. You are trying to prevent these droplets, okay, which can travel up to 2 meters in the air and then get into the other person who doesn't have the disease through 3 ways: eyes, the nose, or the mouth. Okay, so there are 2 things. 1, it needs to be transmitted, and 2, it needs to go inside the other person. If these 2 things are stopped, then the virus, the method of transmission of the virus is then curtailed. Okay, but the other thing you have to remember is that the droplets can also drop onto surfaces. Yeah, so this mouse that I've just held, if I have a COVID SARS-CoV-2, if I have the virus, it will be all around this mask. It certainly be all around this keyboard, this computer I'm facing. Right, so doorknobs, pens, okay, money, you hold money all the time. So these are really hotbeds for viruses. So these viruses will stay on that object, and if you hold that object, you will not get COVID. Okay, you need to hold it. It needs to get into the person. So if you hold that object, then you rub your eyes, okay, you korek hidung, okay, or you put things in your mouth, okay, you inhale it, then it gets into you. So that's how it transmits. Okay, so that you must understand that very very well. Okay, it does not transmit in any other way, right? So that's why it's important for us to distance ourselves, and we also need to have frequent hand washing. Okay, so to destroy the virus, to prevent it from spreading to other people, right? Now, if you understand the methods of transmission, then you would in a certain way know how to prevent it from passing from one person to another. Okay, so people ask me, how long, doctor, does this virus stay on various surfaces? Okay, now coronavirus, SARS-CoV-2, COVID-2 is a new disease. This virus is actually new. Okay, not much is known from the virus itself, apart from it shares quite a lot of characteristic with the virus that causes SARS. Okay, so what you see in front of you is how many days a coronavirus. Yeah, I'm not talking about the virus that causes COVID. This is a general classification of coronaviruses. Yeah, the family of coronaviruses. There is no studies showing how long COVID-2 virus stays on objects, on surfaces. Okay, so coronavirus itself can vary quite a bit. Yeah, from 5 days to 2 to 8 hours. So you really don't know. Yeah, actually the answer is we're really not sure how long it stays. So very very important to wash your hands. Extremely important. That is probably the most important way, apart from social distancing, to actually prevent the transmission of coronavirus. Sorry, COVID-2. Yeah. Okay, so people ask me, doctor, what are the symptoms do you get when you have COVID-19? Okay, sorry, not COVID-19. Um, the most frequent feature or symptoms would be a fever. Okay, a lot of people, nearly 80%, even more than 80% in studies, some studies have showed 90% of people with COVID-2 would have temperature. Okay, so that's why one of the easiest screening tool is taking your temperature. So nowadays you go to any buildings, masuk hospital, anywhere, they will check your temperature. Okay, second is cough. Cough can also be quite a common symptoms. Fatigue, you feel tired, penat, and things like that. Some sputum production, kahak, buang kahak, and shortness of breath. Okay, but there are other symptoms as well. Going down the list, some people have diarrhea too, but very very small percentage of people. Now, the problem with these symptoms is that it's very non-specific and very vague. So if you have a fever, a lot of things can give you a very high temperature. Okay, for example, if you are in the hot sun, suddenly you come in, you will have some sort of a temperature. Okay, but that's quite normal. And if you have a cough, doesn't mean that you have COVID-19. You might just have an irritation at the back of your throat. Also, if you are fatigued, a lot of things can cause fatigue. So the problem lies in that with the symptoms of COVID-19 or any virus-like illness for the matter is not very specific. Okay, so we can't really rely so much on the symptoms to diagnose somebody with COVID-19. Most people will have very mild symptoms. Okay, so the young people probably have a bit of a fever, a bit of a cough, and that's it. Okay, but it's the elderly and those who have underlying disease that I've talked about just now are the one who are most at risk of suffering from the disease. So you're talking about your father, your grandfather, okay, your parents, your brothers and sisters who are sick with high blood pressure, diabetes. These are the people who are prone to having problems if they have COVID-19. Now, some patients are asymptomatic. Yeah, asymptomatic means they have COVID-19 but they show no symptoms. So you don't really. Some people have no symptoms actually. Asymptomatic we call them. So there's a term now saying that these asymptomatic people are the asymptomatic super carriers. Okay, so because they actually don't know they have it, right? They are well, they move about, they go anywhere, and they just spread it to everyone. So very, very important that that's why it's very important for us to have this movement control order to actually prevent any sort of gathering, so prevent any sort of possibility of transmission, even from asymptomatic patients, asymptomatic people with COVID-19. Okay, now the incubation period is 14 days. What is an incubation period? Incubation period is the time from when you are first exposed to the virus to the time you first show signs or symptoms of the disease. Okay, so somebody can get the virus today but only show fever or cough or whatever 5 days down the line, 7 days down the line, 9 days down the line. Some might not even show any symptoms at all, but most will show symptoms at day 5. Okay, some have shown that the median incubation period is day 5, and by day 14 most people would have shown some sort of symptoms. So that's why you see a lot of the word 14 days. Yeah, so if you are in contact with anybody 14 days before your symptoms, so that is why they take this period of 14 days. So if you have been exposed to somebody with COVID-19 and you've passed the 14 days incubation period, you have no symptoms, so it is good in a sense compared to if you meet somebody within the period of incubation. Okay, so I hope you understand that. Sometimes some people can have a bit of a confusion. So again, incubation period is the time between you first get the virus and the time that you first exhibit symptoms. Okay, in COVID-19 it's the median, the average is 5 days, and by 14 days usually people who show symptoms would usually already have shown symptoms, right? Okay, you all, okay, when do you actually test? Okay, this one is a bit confusing for a lot of people. There's only 2 things you need to remember. Okay, if you will need tested if you have symptoms like the one showed in the previous slide. Okay, if you have any of these symptoms, well, basically fever, okay, or cough, temperature, shortness of breath, and you have been traveling to a place where there has been COVID-19 outbreak, you have been exposed to somebody with COVID-19 the past 14 days, only then you will need to be tested for COVID-19. The other group is that if you are in direct contact of anybody with COVID-19, you will be required to have the COVID-19 test. Okay, if you are in any other group, you are not required to do the COVID-19, but if you want, you can do it privately. Okay, so again, if you have fever or any symptoms of lung problems, shortness of breath, cough, and if you have been in contact with somebody with COVID-19 over the past 14 days or traveled to any area with high prevalence of COVID-19, then you will need to be screened. Okay, nowadays nobody travels because we are all locked into our own respective countries. So mostly if you are in contact with anybody with COVID-19, you will need to be tested. Okay, clear, yeah. If you have fever, cough, bit of short of breath, that's all, you have not been in contact, nothing at all, then it's fair enough for you to go home and better if you are self quarantine yourself. Okay, but if you have any of the symptoms but not no traveling, never be in contact with somebody, then that's fine, you don't need to worry. Okay, but if you are worried, contact the CPRC hotline. There will be somebody there to help you. Okay, clear, yeah. If you're not clear, ask again in later when we finish the webinar. I'll be happy enough to answer any of your questions. Okay, so we are all under MCO currently. MCO is very very important, please adhere to it. Okay, so initially when MCO first started, people thought, oh great, okay, we all can stay at home, duduk rumah, let's buat kenduri and get all our family around together, all our friends together, we have a party. Okay, no, that's not the point. The point of MCO is actually to prevent any social gatherings whatsoever. Okay, so be it going to the mosque, to the church, to the temple, anything like that. Okay, playing football matches and things like that, those are all actually prohibited. Okay, so the MCO is actually to prevent you from making yourself into a group. Okay, so don't think that now that you're off chotis, the way you put it, you can lepak with all your friends, form a group, etc. No. Okay, objective is for you to stay at home to prevent the transmission of COVID-19. Yeah, so why is MCO needed? This is very very important. Okay, now you can say that it is needed to reduce the spread of the disease. That means reducing the number of cases. Okay, but the other important thing is we need to reduce the rate of spread of the disease. Okay, so what we call flattening the curve. Okay, you've heard a lot of this, flattening the curve. What is actually flattening the curve? Okay, so if you look on the graph in front of you, there are two graphs here. One is the red one is the blue one. Okay, the area under the curve, okay, between the red and the blue one is actually the same. So the area under the curve actually presents how many people actually gets COVID-19. So in these two cases, the area under the curve is actually the same. So there is the same number of cases. But what we want to prevent is this shape of a curve, what we call a fast pandemic. Okay, the blue one is what we call a slow pandemic. Okay, so if you see a fast pandemic, the disease, the rate of spread gets high very quickly, whereas it's more controlled in the slow pandemic. Okay, so if we don't have MCO, people don't practice safe hygiene, we transmit it exponentially. This is what happens. Okay, this is a very important line. This is the capacity of our healthcare system. Okay, in Italy this happens, they can only cope until here, right? So when this happens, this group of patients on top of this line will then have problems. Okay, there's no beds, there's not enough doctors. This is when you have to choose who lives and who dies. Okay, not an easy decision, but that's what we want to prevent. What is our curve like? Okay, so what is our line? What is our capacity of our healthcare system? Okay, if I'm not mistaken, yesterday the DG of Health say this line of ours has 3,400 beds for COVID-19 and 300 ICU beds. Okay, so that's our current line. If that line is breached, then we will see a lot of problems. Okay, so you must remember this capacity of our healthcare system is not only in terms of equipment but also manpower. Okay, a lot of my colleagues, my doctor friends are working flat out. Okay, tak tidur 2 hari pun ada. Okay, it's not easy. If you tried that PPE suit, if you've been on that PPE suit, right, even for 1 hour you already berpeluh. Okay, you sweat like buckets, and you imagine wearing that stationed outside in a tent. Okay, so they are going through very hard times to protect us, so please do our part. But we have to try to get our curve this way so our health system can cope with the burden that is given to them. Okay, but you have to remember, because of COVID, other diseases also cannot be treated. Yeah, those who have heart attacks, those who need operations urgently, they all have to be delayed. So all this is creating a very, very big problem to our health system currently. Okay, please bear that in mind. That is why we all have a responsibility to flatten the curve. Okay, we need to flatten the curve. Okay, so this is not WHO tips, yeah. This is WHO, not WHO. WHO tips to living under curfew. So currently we have the MCO order. So everybody's need to stay at home, prevent themselves from going into crowds. So you must do certain things. These are some of the advice that World Health Organization say. Okay, so one way is eat healthily. Okay, so eat healthily. When you're at home, you can cook. Generally, you can eat healthier. There's no certain food that is proven to protect you from the virus as such, but in general, fruits and vegetables are good for you. The good thing about fruits and vegetables is they can be kept, they can be frozen, you can cut them up and freeze them. So there's no problems with regards to it being perishable. Okay, fruits and vegetables, if you freeze them, they will not lose their vitamins, their minerals, it will stay the same. Okay, for those who drink alcohol, please limit your alcohol. Sugary drinks, now we tend to buy more canned stuff because you can keep them. So if possible, have a read at the label. Reduce things which are high in fat and also sugar. Okay, again, don't smoke. Smoking has been shown to exacerbate COVID-19 symptoms and increase your risk of getting seriously sick if you have COVID-19. Okay, so exercise for 30 minutes a day for adults and an hour for kids. This is still the general advice. Okay, Malaysians a bit difficult. No curfew also, never exercise. What more you want to ask them to exercise when they have their curfew? But anyway, there are means and ways for you to do this. Okay, maybe before you have no time to exercise. Now you have no excuse really. I will give you some examples after this, a few slides to show what you can do to exercise at home. So if you can't leave your house, okay, fill your time with activities such as these. Okay, yoga, walking up and down the stairs. Okay, these things also help you to exercise. Okay, exercise actually is not only just for your physical being, it's also very good mentally. Okay, so now the other thing is people working from home shouldn't sit too long in the same position. Okay, take a take a 3-minute break every 30 minutes, walk around, go up and down the stairs, and also drink plenty of water. Okay, water hydrates you. Okay, that is all that is proven. It does not prove anything with regards to immunity or treatment of COVID-19. Okay, get your mind off the crisis. Okay, now everywhere you look is COVID-19. Every WhatsApp you read is COVID-19. So I think sometimes it's good also for you to chill, listen to music, read a book, play a game. Okay, that helps you in a way lift your spirits up in what we see sometimes as a very bleak sort of times that we are living at the minute. Yeah, so again, what can you do when you are under MCO? Okay, on the left is an example of what you can do at home. Okay, in terms of workout, this is actually from my local gym. Okay, they have come up with a home workout that you can do. Okay, I'm sure your local gyms will come out with that as well. There's a lot of material on the internet. Okay, so things like jumping jacks, lunges, sit-ups, all those you can do without equipment. Okay, if you want weights, okay, improvise. Take a bottle, fill it with water. Okay, you can use that as weights. Steps, you can take a very low chair to use it as steps, or you can use your stairs as steps for you to exercise. Okay, um, cardio, one of the best cardio things to do statically, if you can't move, is actually skipping. Okay, so if you can skip, provided you can skip, if you can skip, skipping is a very good exercise for you to do when you are at home. Okay, a good cardio workout actually. Okay, so go and find out from the internet. There's a lot of it there. Call your local gym and ask whether they can come up with a workout for you. Okay, but on the other side of the coin, okay, you can see that coronavirus is also causing a lot of mental health issues. Yeah, so people are getting desperate. Their mindset is changing from living to survival mode, right? Some people feel hopeless because they seem that they can't do anything. They want to help, they don't know how to help. Of course, job security, your grab drivers, your taxi drivers now have no jobs really. Okay, financial security. So all this actually causes a really great burden, yeah, to the individual. So those of you who have Naluri app downloaded, okay, please bear in mind we have the psychologists are all around you to support you in any way we can. Even our PT, our physical trainers, would be happy enough to advise you on exercise that you should do or you would want to do during this MCO. Okay, so those of you who don't have Naluri app, you can download it. Later I'll show you how to download it. And because you're so good, you've seen this webinar, we will give you a 1 month trial period for it. Okay, so it will actually help you, and then hopefully everyone will be able to go through this better. Yeah, so general advice, please adhere to whatever MCO has told you. Okay, please maintain social distancing. No events of any kind, please. Okay, that is not the objective of the MCO. So don't arrange anything publicly. Even I have to do this webinar in my own home today. Yeah, so self hygiene, hand sanitizers, hand wash, very important. Okay, wash your hands with soap as much as you can. Okay, bring hand sanitizers with you. Wear a mask if you can get your hands on one. Okay, and this mask should be 3-ply, not 2-ply, not 1-ply. A 3-ply mask, which if you use, do not use for more than a day. Okay, I have patients who've used the mask for 3 days. No point. These masks are only to be used at the most 1 day. They are to be discarded properly. You throw them, you open them up, don't touch the front and don't touch inside. Okay, take them off, throw them in the bin which you can close. Okay, very important. Sneeze and cough hygiene. If you don't wear a mask, if you sneeze and if you cough, it is best do not cough or sneeze in your hands, because you're going to transfer all the droplets to your hand. Sneeze and cough on your sleeve. Okay, put your head to one side, sneeze or cough on your sleeve, and go back, wash your clothes every day. Go for testing only if you need to be tested. Okay, if you don't need to be tested, don't go for testing. right? You're just creating a lot more work for our health services which are already at a stretch. Okay, don't lie about your medical history, your social history, your travel history, please. Okay, in the hospital where I work in, people actually lie just to get into hospital. They've been traveling, and because they have a specialist appointment today, they don't want to miss it. They lie. They say no, I haven't got, and then they get inside the hospital. Please do not lie about your medical history. Do not lie about your social history. Okay, and also your travel. Very, very important if we are to prevent the transmission of COVID-19. Do not travel if you don't have to. Okay, this is not only overseas, also interstate, and also anywhere else for that matter. Okay, now number 6 is very important. Um, I've just put this right at the end because our frontliners are now getting very, very stressed. Okay, so please lend a hand to those at the front line just by staying home. Okay, you can also help them in a lot of ways. Our policemen, our army officers looking out for us. Okay, lift their spirits up. Okay, currently, as of this morning, I've also had, for example, requests from hospitals. I do some work in collecting equipment. Some hospital needs a lot of things. In this morning, I had a request for portable aircons to be put in the tent. Okay, so where you can come is there's a lot of NGOs now requesting some kind donations from the public for this sort of purposes to help our frontliners. So please spare a thought for them. Okay, they are here to protect us. I think we owe it to them to help in any way that we can. Okay, I have a anti-COVID-19 station at my house. Might be a good idea for you to do this. Put this right outside, not outside. As soon as you enter the house and before you get out, you should have this station. Okay, have a mask station, and also disinfectant. Sorry, not the hand sanitizers. Sorry. Okay, so I have two daughters with me, so we would have 4 of these bottles. So every time we go out, each one of us will take one of these bottles and use it, and when we come back, we put these bottles back. Okay, so in this case, my wife is away, 3 of us are still home, so hence the 3 bottles are still at this station. So it's a good habit for you to make things small, especially your children. Get them into the habit of bringing hand sanitizers and using them whenever you can or whenever you need to. Okay, so in summary, COVID-19 spreads very, very, very quickly. Okay, it spreads very easily. Transmission is via droplets, so please maintain social distancing, 2 meters, because this is how far the droplets go out to. Okay, we need to protect the elderly and the vulnerable. So it's not just about you. You can get COVID-19 and have no symptoms or a little bit of symptoms. That's fine. Okay, but imagine if you have it and then you go home and you hug your grandfather, you hug your elderly father or your mother, and they inhale the virus. They are the ones who are vulnerable. They are the ones who actually are in big trouble if they have COVID-19. Okay, we are all responsible to flatten the curve. Okay, please help us, help flatten the curve, because if it goes up too high, you will see what will happen just now. As in the previous slide, we will have problems with our healthcare system. It will just break down, and this then will become the problem, just like the Italians. Okay, this is your CPRC helpline. I'm sure you all know. Get this number. If there's any problems, any questions, you can also ask. You can also call this CPRC helpline or also via email. Okay. Okay, so Naluri is actually a multidisciplinary health app. So in the app, we have all these multidisciplinary professionals, from doctors, psychologists, dietitian, fitness coach, even executive coaching, financial planner, and also pharmacist. Okay, so if you download the app, you have all these people at the tip of your fingertips. You can chat with any one of them, and you can get first-hand answers from the professionals yourself. Okay, so those who have not downloaded the app, please do so, and I think the details would be here. Okay, so just scan, the QR code is there, just scan it. Okay, when you register, they will ask you for a sponsor code. Use that sponsor code, Naluri for Dr. Shah. Okay, and just explore the app at your own time. Yeah, you can always, those who register under this sponsor code, my sponsor code, you will have access, when you have access to chat to me at any time. So if you have any questions, you can ask me via this method. Okay, so I think that is it at the moment. Yes, I think that's it. We will leave this up. Okay, so just in case you wanted to see the link. Okay, so what I'm going to do now is, oops, sorry, that's not it. Okay, what I'm going to do now is answer some of your questions. Okay, let's see. Don't know where I'm going to start, but let's see. Okay, Azran Osman Rani asks, please explain why even jogging alone on the street in the park is prohibited. Okay, this actually, okay, this I think comes up from, I think, a viral from the cardiologist actually, who went running on his own. Okay, now I've split into two with regards to this actually. Okay, if in an ideal situation where there's nobody else about, okay, say if you're going to run at 5 o'clock in the morning all on your own, then I don't see why you shouldn't. Okay, but it also boils down for you to be setting an example to other people. Okay, people can always say, if he does it, why can't I do it? So if you have 100 people doing that with the same explanation and the same answers, then again, we're gonna have a crowd, and this is not possible. Okay, but I mean, if you're living all alone somewhere, then it's not a problem. But I think it's more than that. We need to set examples to other people. We need to set examples to our children and everybody else. So I don't think that's a good thing to do. Okay, is it safe to buy groceries every day if we need to, since we did not buy in bulk? Um, Buying groceries every day, if you need to, yes, there's no harm for you to go to buy groceries. Okay, but the objective here is for you to try and prevent yourself to being exposed to large crowds whenever possible. So that's why you are advised to do a big bulk of shopping at the time. The more you are exposed, the more you are allowed to go out, right? The more you are exposing yourself and also exposing other people to the virus, and you are more prone to it being transmissible to you. Okay, so some people, okay, Florence has asked, some people have resorted to DIY mask. Okay, is this recommended? Okay, proper PPE, proper personal protective equipment gear, goes through a lot of stringent checks in order for it to be passed as something what we call medically grade. Okay, so obviously, if somebody does DIY mask, they are not tested. Okay, they're certainly not medically grade. So it is not recommended if you have the proper thing to use. Okay, it also actually depends on how good actually these DIY masks are when you make them, who makes them, etc. But personally, I think it's better than nothing. But if you can get something that is proven. Okay, when you say DIY mask, I wonder what you mean. Okay, there's a lot of sorry to say, but there are a lot of people showing they use, sorry to say, underwear as masks. Of course, those are not advisable at all. But the one that they used to have screens, okay, hospitals are making them as well now. So again, those are better than nothing because they actually protect your eyes. When you use the normal mask that you use, they are not actually protecting your eyes, which is a possible entry um, entry of the virus into your body. Okay, but I would probably ask you to wear masks that are medically graded and sold. Okay. Do we need the elemental? Let us. Where's elemental? Oops, I've gone all the way down already. Okay. Do we need to be worried about vegetables and other times when we go grocery? If someone who is positive were to touch an item of veggie, is there such thing as getting COVID from such contact? Okay. So, okay, do we need to be worried about vegetables and other items when we go grocery shopping? Okay, the short answer to it is actually no. If somebody who has COVID touches the vegetables and stuff like that, okay, you need to touch the vegetable and then touch your eye or inhale it and things like that in order for it to get into your system. Okay, depends on how long the vegetable has been out there. That's why it's important for you to wash your hands every time. Wash the vegetables that you buy, the grocery that you buy. But in short, you don't need to be worried as such. Take precautions. Okay, wash your hands often. But the transmission of these droplets have to be to a certain time. Yeah, close contact. They say you have to be exposed 15 minutes. So there need to be a quite a certain amount of the virus for you to inhale, for you to get it as well. Not if you the guy walks past you, the chances are less. So again, the same with the vegetables. Okay, very unlikely. So Florence asks, what if someone had COVID-19 but recovered now and tested negative? Is the virus still inside his body, although his body has fought and gained immunity? Can this person still spread the virus? Okay, so generally, if somebody has COVID-19, has recovered and tested negative, the virus has already been shared. Okay, so usually they are not infective and they will have immunity to COVID-19. It is too early to see whether there is any reinfection to those who already have the disease. Okay, there are some cases where they have suggested that there is, but there is no formal really evidence written to show that. Okay, so in general, if you have recovered, you tested negative, then you will not be able to spread the disease. You are already cured. Okay, so Florence again asks, how long does it take for this pandemic to start to slow down again? Are we facing the situation same like China, Italy? Do you think the MCO will be extended? Okay, if you look at graphs, okay, we last week or maybe 10 days ago, our graph of incidence is the same with Italy. Okay, but today the graph has a bit siphoned off a bit. We are a lot more controlled compared to Italy, right? So again, how long does it take for this pandemic to start to slow down? Really depends on how well this MCO is being adhered to. Okay, if this MCO is not being adhered to very well, then it serves no point. The pandemic will start to continue. Okay, so it is very important that we don't want to have a fast pandemic like I've said just now. Okay, if it's a slow pandemic, then it is easier for us to control it. Okay, personally, this is a personal opinion. Yes, I think the MCO will be extended because I don't think numbers are quite there yet, but this is a personal opinion. We will need to see. It's too early to know the effects of the MCO since it's not only been on for a week. Okay. So Liana Haley, I have a question for my expat friends. Since they're in Malaysia, how or what can they do for the high income expats, resident or PR pass versus students and tourists that are stuck here? Okay. I don't think there's much that different that they do from us. Okay. Again, they need to practice social distancing. Again, not go out to places where it is crowded. Practice safe hygiene. There is not much difference in the sense of what they do and what we do. Okay. They don't need to do testing or anything like that unless they come into the category that I've spoken to just now. Otherwise, the same rules apply. Okay. Lawrence Tan is where? Oops, sorry. Is COVID-19 airborne? Yes, it is airborne in the sense because it spreads through droplets. Okay, but it's not airborne where when I say it's droplet, it doesn't fly away like aerosol. Okay, it has a limit of about 2 meters and then and then it goes down. So when you ask whether it's airborne, it is airborne in that sense, but it has a limit of about 2 meters, but it doesn't fly off like aerosol when you spray. Yeah, so it's not like that. So it's airborne in a certain way, but not aerosol way. Okay. Should the MOH set up drive-in testing at hotspot areas to stop contamination of the hospital wards? Okay. Okay, you have to understand that testing, there are two things. Okay, one is testing itself. The testing itself has to adhere to very strict SOPs. The person testing it, the person being tested has to be suited up properly, have to have the right environment, the specimen has to be brought in a certain way. So a drive-in like the one you see in McD's is probably not is a good idea if you can get those things or those um, situation that way. Okay, so you need to have proper PPE, you need to have proper SOPs, proper area for you to collect the specimen, proper storage, proper transport, etc. Okay, and what if you get somebody who drives in and who is positive? What are you going to do then? Okay, ask them to get out of the car, leave their car there. So a lot of things. So not a good idea at the minute. Okay, it's best that you stay put where you are. MOH will send somebody down to test you and then do what's needed. Okay. Liana again. Okay, some high-income expat students, tourists are wondering where do they fit in this Malaysian situation? What benefits do they get? Okay, a tough question that for me. I think I'm more looking at this in the medical point of view. So I'm not sure what benefits do they get. I can't entirely answer that for you, Liana. Sorry. Is it okay if I'm not using any mask as I don't have any health problems? Okay, this is a tricky one. Okay, initially, a lot of studies say the mask is only needed to be worn by people who are coughing and sneezing to prevent these droplets from getting out. Okay, but more and more advice nowadays have said that if you have a mask, wear it, because whatever protection you can have from it getting in by you wearing it, you should wear it. Okay, so it's advice change as things progress, as the disease progress. Okay, personally, I wouldn't, I would have no, previously, maybe you're talking 10 days ago, I would have taken it would not too seriously, but now I make sure that I wear a mask whenever I go out, put it that way. Okay, Florence, could you provide a clear definition on close contact for casual contact, or two for casual contact? Okay, okay, close contact are people who have direct contact with somebody with COVID-19. Okay, if they spend 15 minutes in close contact with somebody with COVID-19, if they are a healthcare worker looking after somebody who has COVID-19 positive, doctors, nurses, if you are in the same room for more than, I think it's if you're in the room for more than 15 minutes or an hour, I'm not sure uh, with regards to 50 minutes, or I'm not sure with somebody who has COVID-19. Okay, so that is close contact. Okay, close contact really is first line. Yeah, means you are in direct contact with the person. Casual contact is less than 15 minutes. If you are a second tier contact, okay, your husband, boss has COVID-19, your husband is a close contact, but because you're in contact with him, you're a casual contact. Okay, uh, so if you are close contact, then you are required to be tested. That means close direct contact. Yeah, you need to be tested. If you're not, then you don't. Okay, I can give you further clarification with this afterwards. uh, can one spread the virus while in incubation? Yes, definitely. Okay, incubation wait, I don't one. Okay, let me answer this. Can one spread the virus while in incubation? Who's in the incubation, the virus or the person? If the person is incubation and he doesn't get out, he won't be able to spread it. But if the virus, you the virus in its incubation period can spread the virus. Okay, so incubation period, remember I told you just now, is 14 days for the virus. So if the person gets the virus within that 14 days or that incubation period, yes, he can spread the virus. Okay, um, I done Sahiran. Dr. Shah, Florence is asking many questions and she's forwarding on question from PwC employees. Okay, no problems. If a patient have recovered from COVID-19, will they still need to be quarantined? No, they don't. If they've been recovered, being discharged, they don't. Thanks, Aiden. Okay. Do you know the situation on vaccine for this virus? Vaccine for this virus is actually ongoing, but research says that it will not be for at least another year before a vaccine can actually be found. So a bit too late. So I don't know whether there's any new breakthrough that might make the situation faster. Okay. What do medical staff do to treat COVID-19 patients? Okay, I'll not get down to that because it really depends on various stages of the disease. Some people have symptoms, some people have very light symptoms, some people need ICU time, some people need intubated. So there's uh, a lot of vast treatment given to different sets of people. So I don't think I'll get into that. Yeah, can Florence again ask, can ask if we have only fever but no other symptoms, is it encouraged to go for COVID-19 test or must be having ill? Okay, if you have fever and no other symptoms, if you have not been in contact with anybody with COVID-19, if you have had no travels over the past 14 days, then you will not need to have any other tests. Okay, if you have fever and other even if you have fever with other symptoms like cough, what else? Cough, shortness of breath, but you are still you still have no contact with anybody who had COVID-19 over the past 14 days. You have not traveled to any pandemic areas over the past 14 days. Then you probably you definitely do not need testing, but it's a good idea for you to maybe undergo self-isolation for 14 days. Okay. Um, okay. Question from you. Do we need to sanitize packages that we have been sent? Do we need to sanitize packages that have been sent to us by e-commerce websites like Shopee? Okay. Good question. I would probably not do that, but it's probably better, or it probably makes sense to open the package throw it in the bin, and then wash your hands. Okay, that is a better sort of way to go around it as opposed to sanitizing all your packages. Okay, open the package, get rid of it, wash your hands. Okay, if the package is from China, it's very unlikely that the virus is still alive. Okay, because it takes a long time for the package to come from China. It undergoes so many different temperatures in the plane, in the ship, or whatever. The virus would probably not survive. Okay, but wash your hands. Wash your hands. Okay. Does the hospital still allow for visitors during this period? It depends on different hospitals have different guidelines. The hospital where I work in currently only allows one visitor at a time for each patient. Okay, so this really depends on the hospital that you want to visit. Okay, and also probably depend on the department that you are visiting. Okay, but I wouldn't probably avoid visits to hospital at this point in time unless you really need to. Okay. Okay, Rico, good question. Is COVID-19 dangerous for people aged 40 and below? Okay, COVID-19 is dangerous to everybody. Okay, it is more dangerous to those above 60 because a lot of studies have shown, especially in China, that a lot of, especially in Italy, a lot of the death in Italy happened to elderly people. Okay, but it doesn't mean that those below 40 are immune. Okay, there have been cases where people die when they are young. Okay, if you are below 40 and you have other diseases also, you are very high risk. Okay, but what I don't want to put out in front here is that people thinking like, oh, I am young, if I have the disease, it probably will not affect me much because I'm still young. That is true, but that's beside the point. If you get COVID-19, you must also think about other people. Yeah, you might not get the full symptoms, but you become a carrier. Okay, so nowadays the carriers are usually very mild and asymptomatic. These are the super carriers. Okay, the young people are the super carriers because they don't feel anything. They are generally quite well. If they are not well, they have very mild symptoms, but they are the one who spreads them to all these people who are vulnerable. Okay, they are actually the one who actually kill other people with coronavirus. So it is not as dangerous if you are below 40 compared to you are above 60 if you have the disease, but it is as important for you to prevent the transmission. Okay, because if you have COVID-19, you will be in hospital, then that's one more bed less for a person who really needs it. Okay, so Mylene asks, what is the hotline we need to call if we feel we have the symptoms? Okay, there was where is the hotline was somewhere in oops, hold on, sorry. Okay, that's the hotline there if you can see. Hopefully I will leave it up there for you to see. Okay, the hotline is there for you to look at it. There I think, oh okay, Azran has answered it. Thanks, Azran. Okay, what are your thoughts on delivery people like Grab for food? Is there a risk of contracting from these delivery guys? Okay, your risk of contracting COVID-19 is probably the same just as with any other people. Okay, now in theory, the more people you meet, then the more chances you are of contracting the particular COVID-19. Okay, so what I would advise you is that if you order anything at all, okay, be it e-commerce, Grab, Food Panda, whatever, social distancing still remains. Okay, so ask them to put the food, just put it there, you go and get it. Okay, once you get it, open everything up, throw it aside, wash your hands. Okay, so all this, again, it always comes back to all these basic things. Okay, so always maintain social distancing. To a certain degree, these delivery people probably are a bit more at greater risk of contracting it than people who stay at home, because they actually do not observe MCO, right? So yes, higher risk for them, but for us, protect ourselves. Yeah, maintain social distancing. When you get your food or whatever, okay, you don't need to disinfect the thing, right? Just open it up, throw it in the rubbish bin, wash your hands. Okay, always remember, wash your hands, wash your hands, wash your hands. Okay. Thanks Azran for the hotline. Florence Tan, if people have traveled, they will need to self-quarantine. Do they need to only do a check if they show symptoms? And the people around them, will they need to practice self-distancing? Yes. If people have traveled for the past 14 days, because it's spread so much worldwide, if you have traveled the past 14 days, then you will need to practice self-quarantine. Okay, so be in one part of your house or your room with minimal contact with other people. If you start to show symptoms, then you might need to have it checked. Okay, so the symptoms are, as I said before, if they have fever, if they have temperature, if they have cough, shortness of breath, those kind of things, and that becomes a symptom with history of travel, then you need to be checked for COVID-19. Okay, uh, and for the people around them, will they need to practice self-distancing? Yes, always maintain self-distancing with anyone that you know. Okay, you want to really even practice self-distancing in your house. Okay, just practice it, no problems. Okay, but if somebody who has traveled 14 days, they come back, then yes, the household should practice social distancing with that person. Okay, Rico then asks, people who recover from COVID-19, are they still susceptible to reinfection? Okay, COVID-19 is a very new disease, not a lot of things we know about it. Okay, um, I'm not sure about literature, or actually there's actually anything found in terms of people who have recovered getting reinfected. Um, Theoretically, if you go by SARS or any other viral illness, once you get that certain illness, you usually don't get it again. And if you do get it again, it is usually milder than the viral disease that you have before, because you have some sort of immunity towards towards the virus. So it is still new. We're not really sure whether it can reinfect. The possibility is there. Yeah, very low probably. Okay, so Florence, if the person prepared the food in restaurant is COVID-19 tested positive, will we? Yes, definitely. Okay, uh, if that person is a COVID-19 positive, he shouldn't be at the restaurant. Okay, because he is basically exposing everybody. So that's why, again, we should practice self distancing again. Okay, social distancing. Yes, the short answer to that, if the person prepared the food in restaurant is COVID positive, will we be exposed to the virus? Definitely yes. So again, Florence, should patients still go for hospital appointments already made earlier during this period? Okay, follow the advice of the clinic or the doctor that is treating you. If they say service is as usual, then by all means please go and see your doctor for your appointment. Okay, but bear in mind, you have to be responsible as well. If you are sick, if you are having a temperature, having a fever, then please don't go to the hospital and spread it around. Okay, so the short answer to that is, if the hospital is saying that everything's your appointments are all still normal, then please attend your hospital appointment. But at the same time, please be vigilant in the sense that if you are sick, you're not well, please be responsible to cancel the appointment and do not go. Okay. Let's see. Okay. How soon can the virus be detectable? Will the virus be undetectable if, for example, one gets tested one day after exposure? Okay, that's a very good question. I'm different tests have different sensitivity and specificity for that. I'm not able to answer that question fully at this point in time. It's a very, very good question. I will need to have more information on that. Okay, but it's usually quite sensitive in the sense that if it's in your system, the test usually detects it. Okay. Is it recommended to get the flu vaccination if available? Okay. The flu vaccine is for to prevent you from getting the flu, which is a virus. Which the flu is actually caused by a totally different virus than COVID-19. Okay, so firstly, I need to point out that the flu vaccine will not do anything with regards to whether you are more at risk or not to have COVID-19. It will only protect you from getting the flu, okay, seasonal flu. This flu also every year is a different sort of flu. Okay, the virus is different. So if it's not for the current COVID-19 problem, then I said yes, it is recommended for you to get the flu vaccine, especially if you are the elderly and you have other diseases like heart diseases, lung diseases, diabetes and things like that. Yes, it is recommended for you to get the flu vaccine if the current situation is not as it is. Okay, but I think in current situation, I think you could leave it first because our healthcare workers have more important things to look out for at this point in time. Maybe when everything settles a bit more, then it's probably a good idea to have your flu vaccine status checked again. Okay. If I have fever and self-quarantine for 14 days, is the self-quarantine period start from the first day I have fever or after I recover? If I have fever and so is the first day of the fever, not after you recover. Okay, it's the first day after. It's the first day after you have symptoms. Okay. Okay. For those with asymptomatic, how do they know they would need to do the testing and confirm not infected? You just can't. Okay, if you are asymptomatic, you have no symptoms, so you really can't test. Imagine if we are testing every asymptomatic person, then basically we are testing the whole world. Okay, we are testing everybody. In an ideal situation, ideally that's what you want. You want to test as many people as possible. Okay, but it is just not feasible at the moment. Okay, if you are asymptomatic, people who are asymptomatic are probably the last people that should be tested. Okay, so if you are asymptomatic and you carry the disease, you probably wouldn't know. That's where the other problem lies. Okay, you have these asymptomatic super carriers. You might carry it, but you don't even know. Okay, how long can someone be an asymptomatic carrier for this virus? Okay, we don't know. As I said, usually until they are treated, until the virus clears away, right? And we don't really know how we don't really know much about these viruses to know how long it can stay in somebody's symptom. In somebody's system. Okay, I'm also mixing up my words now. So we're not really sure, but you can be asymptomatic. Yeah, and it's very difficult to know because when you are asymptomatic, you don't feel anything, so you won't know whether you have the virus or not. Okay, if we took influenza vaccine, will it be more than enough? No. Okay, an influenza vaccine does not cover. Okay, influenza vaccine covers for a certain other viruses that cause the flu. It is not a vaccine for the virus that causes COVID. So, an influenza vaccine does not do anything with regards to your immunity, to will not do anything with regards to you getting COVID or not. It will do nothing at all. Okay, it's not targeted towards that particular virus. Can pets get COVID-19? And is homemade sanitizer advisable or effective? Can pets get COVID-19? I don't know actually. I think there have been studies to show that dogs can get SARS-CoV-2. I'm not sure actually. I'm not sure about that. But as I said, these diseases originated from animals. Yeah, so actually, bats, they actually originate from bats and then they are passed on to animals before they are passed to us. So I'm not sure whether it can be passed on to pets. I think literature, there has been a dog. I think I'm not so certain. Okay, homemade sanitizers. Homemade sanitizers. Again, it depends on what the homemade sanitizer is. I don't I'm not advisable. Okay, it's advisable you get sanitizers that you buy off the shelf. And I think that goes on for the next question. For alcohol rub products, how many percentage of alcohol content is advisable for usage? I advise about 70%. Okay, at least 70% alcohol. That probably is enough to kill most viruses. But actually, soap and water is already very good in the sense to kill the viruses in your hand. Okay, but it's easier for you to have a sanitizer lah, because it's just a matter of you can use it anywhere as well. Okay, Mylene, what is the latest update on the vaccine for COVID? Will it be released to public? No. Okay, not really. The latest literature does not show any new evidence that a vaccine is going to come out anytime soon. They are talking about uh, in a year, probably 1 year is the timeline we are talking about, unless there's a great breakthrough soon. But you're talking about, the scientific world is talking about 1 year. Yeah, so still quite a long time. So if a parent is due to take an angiogram procedure in government hospital beginning of April and patient is 80 years of age, is it advisable to proceed? Okay, now you're getting a bit personal. Okay, I don't know whether they're still doing it at the moment. I thought the government is stopping all surgeries in hospital. You're talking about angiogram procedure that if it's heart, I think they're transferring all heart procedures from government hospital to UITM. So again, it would probably be under the advice of the hospital that is doing the procedure. Okay, if they think that person's condition requires him to do the operation there and then he probably has to do it because it's something urgent. Okay, he's 80 years old. Very susceptible if he were to be exposed to COVID. So that is another thing you need to look into. I think best discuss with the surgeon, or sorry, the cardiologist doing it. Okay, because as far as I know, most elective procedures are put to a stop in most government hospitals. Okay, unless that gentleman's condition is really, what do you call this, serious, that they have to do it then. Okay, Okay, what kind of products to use to clean surfaces? Alcohol wipes or regular wipes? Okay, regular wipes would do. Okay, things which with alcohol would do. Dettol is good if you want to sanitize it with Dettol. Again, that's a good thing to start with. Okay, anything with any household detergent would be good. Soap and water is actually good enough to kill the virus. Okay, continue connected to the above. As this is GH, no access to special cardio via phone. Nurses has asked us to decide. Oh God. Okay, if nurses has to decide on nurses has asked us to decide on our own as a family. Okay, um, person who's 80 years old going for an angiogram in the current condition is probably not advisable. Again, it depends. I don't know what, I don't really know the background of the patient, whether his heart problem is really bad or not. Okay, but it's one of those things where it's difficult for me to say, but it's not the best time for you to do an angiogram at this point of time. Okay, family will need to self-quarantine. No, if you're not exposed, you will not need to be quarantined. Okay. Uh, Also, maybe with regards to the angiogram, if we have a cardiologist here in Naluri, so maybe if you want to ask our cardiologist, Dr. Azmi, he will probably be able to tell you more about that. Yeah. Next question, Megan Low. Are there particular practices with washing shared cutlery? Is there a minimum time to soak or contact with dishwashing liquid is? Yeah, normally normal wash with dishwashing liquid, scrub it well, should be sufficient. With regards to that, you don't need to spend a lot of time. But if you're talking about washing your hands, you are recommended to wash it for about 20 seconds uh, with soap and water. Yeah, 20 seconds. Azran, Florence Tan can ask. Okay, Azran asks. Okay, thanks, Azran. Is it true that high temperature kills the virus? Depends on what you say is high temperature. Okay, there's a lot of myth going on there. Uh, one of the WhatsApp messages being forwarded is that, oh, the virus does not like heat and they will die at a temperature of above 29 degrees. Okay, that's not true. If the virus die at the temperature of above 29, then our daytime temperature already is above 30. Then theoretically there should be no COVID in Malaysia. So high temperature kills the virus. Very, very high temperatures. Yeah, what the temperature is, I'm not very sure, but I think about 60 degrees maybe. I'm not so sure, but certainly not any temperature that we can be accustomed to. So in that sense, high temperature, yes, but not really the temperature that we are used to. We're talking about really, really high temperatures. But then again, we're not sure because we don't know. There's not much studies done on this virus because it's relatively quite new. Yeah. Okay, I think we'll leave it at that. Thank you again. Thanks very much for um, for tuning into this webinar. Um, hopefully it benefits you. Very sorry if there's some technical glitches. This is actually the first time I'm doing such a thing, so hopefully we'll get better as time goes by. So in the meantime, please take care of yourself. Please take care of your families. Please always practice social distancing. Very, very important. Wash your hands. Yeah, all the time. Wash your hands, and please help our frontliners in any way you can. Yeah, please, because they really need our help in whatever means that we can give. Okay, thank you very much. Okay, hope to see you all again in the near future. Thank you and have a good and blessed day. Assalamualaikum.